Hello, and thanks for joining today's session in LHSN's Safer Care Accelerator webinar series. My name is Dee Dee Thompson. I'm a policy fellow here at Imperial College's Institute for Global Health Innovation, and I lead on the LHSN program, which is a joint initiative with the World Innovation Summit for Health. We're very pleased to be joined by Dr. Suzette Woodward today, who will be sharing her insights from the Sign Up to Safety campaign here in England. So I will give Suze a very brief introduction before turning over the presentation to her. Dr. Woodward is the National Director of Sign Up to Safety, which is a campaign for the NHS in England to save lives and reduce avoidable harm. Previously, she was the Executive Director of Safety, Learning and People at the NHS Litigation Authority, and before that, the Director of Patient Safety at the National Patient Safety Agency. She is a pediatric intensive care nurse by background and has worked for over 20 years in patient safety at both the national and international levels. So without further ado, I will hand it over to Suze.
Thank you so much, Dee Dee. It's an absolute pleasure to be with you today. As she says, we're going to be talking about Sign Up to Safety today. And I'm going to be talking about, and also a little bit about how you set up national campaigns, just as much as I'm going to be talking about the safety work that we do. Because the way in which you can deliver initiatives and interventions related to safety is really, really important. And I think we're learning an awful lot in the work that we're doing about how you can grow a kind of movement, not as Marshall Ganz might describe as a social movement, but a kind of movement in which you connect people up to something that's greater than the work that they do in an isolated or individual way. So I'm going to talk you through what we do, how we do it, and what we think that we're achieving. So the kind of summary slide is that we obviously have an ambition, which is to provide support to everyone who works in patient safety to help them reduce avoidable harm. This is about enabling others and using a way in which you can create the community. Now, if you have a unifying brand, what we find in the NHS in England is that it gives people permission to do the kind of work that they do under an umbrella. So what we found is that when we set up Sign Up to Safety, we truly wondered whether anyone would join. Because we thought that they've got more than enough to do. They've got initiatives and interventions they're expected to do by our government, by the Department of Health, by various other bodies and organisations. And healthcare is incredibly complex and busy. So why would they want to join up, sign up to safety? So what we said was that you can use our brand to do the kind of work you do anyway. So don't sit there thinking, oh right, I need to now rethink and do something completely different. What we ask them to do is think about what they're actually doing in relation to safety and ask them whether they could fit that under our philosophy and our ideas and our identity. And you'll see that quite a few people thought that that was a really lovely thing to do. So it didn't feel like an add-on. It felt like it was an enhancement, a real way in which they could help do their local work better. So our approach was very much to use the tools and the methodology from people like Marshall Ganz in the US and various others, Helen Bevan in the UK, who really look at the way in which you can engage people and shift them from doing the same things that they've always done to doing something slightly differently, but using the lessons that they already have. And so it's kind of going from the past and thinking about the present and then thinking about what they could do in the future. And the kind of outputs that we use, they are campaign-y type outputs. So they're engaging and participating in things like webinars, like the sort of thing that we're doing today. We have a very simple website. We believe in simplicity and making things really clear for people to just go and get. I need to download a tool. I know where I'm going to go. I'm going to do that. So there's nothing complicated about what we do because life is busy enough. We produce and co-create local events with other people, and we attend all sorts of events across the NHS in England. We also provide briefings and opinion sheets, as it were. So we collate and curate the patient safety stuff that's coming out on a very regular basis, and we provide briefings for people. And I have a blog, and various other people have a blog, so that where we can share our thoughts and our ideas. So the first thing you need to do, if you're going to set up a team to run a campaign, you need to really think about what skills you need. And we actually encourage people to think about this locally. So there's a kind of central campaign, and then what we consider is that we have, of all of our membership, over 390 local campaigns going on. And we ask people to think about the unique mix that you're going to need to run a campaign. What you need is you need an organizer, so you need some really good people who love the detail, love the analytics, love working on creating the way in which you organize what you're going to do. Then you need a communications expert. You need somebody who loves words, loves talking to people, and loves communicating with people so that they enjoy what they're reading or enjoy what they're hearing, and it truly resonates. So you need a sort of inspiring, upbeat, positive communicator. And in fact, all of you need to do that, but you need somebody who's really skilled at being able to help you do that. You do need somebody to kind of lead, but not in the way that you might think about in terms of hierarchy of power, and I talk a bit about that in one of the other slides. And then you need some people who can reach out and influence others and engage. Absolutely, campaigning is about engaging and being a joy to see and hear and meet. Because that's a vital way in which you can help people realize that you're on their side, that you're one of them, not shouting at them, you're shouting with them, you're very much putting your arms around their shoulders and saying, we can do this together. So we have just 4.5 whole-time equivalents, and we have a really small team, central team, who have some specialist support who we help in terms of reaching out and engaging with people and creating our content and selling and sort of helping us sell our stories and our narratives and so on. And they are a hugely highly motivated team. If you go onto Twitter, you can see pictures of our team. When we have our team meetings, we like to post our team meeting pictures of what we're up to, and when we go out and about. And so once you've got that unique team of people, then you start to create your unique identity and approach. And it's really important to ask ourselves right at the beginning, who are we going to be and what are we going to be? Because you can be really strong activists, you can be challenging, you can be negative, and that's in a weird way sometimes quite galvanizing if you are telling people how bad it is. So in order for people to think about how they should be addressing this really important problem. However, we chose to do the opposite of that. We chose to be really positive. Yes, we wanted to talk about the problem, but we also wanted to talk about the fact that there was hope attached to that problem. So we really think about every single word we use. And I mean every single word we use in all of our newsletters, in all of our blogs, in all of our presentations, in the way that we engage with people. We want to come across and we want to be genuine and authentic. As I say, we're with you, not done to you. And so the positive words and the positive language and thinking about every single word is important to us. And we've learned from an enormous amount of different people. There's some great people who teach you how to speak. And so the sort of people like Steven Pinker, who you may be interested in looking at the world of behavioural insights. You may be interested in searching the behavioural insights teams that work across the globe, who help thinking about how you can word text messages and letters to people to engage with them and to help them make different choices. We also work with behavioural change people, and as I've mentioned, Marshall Gans is a key person we think speaks to us and really helps us think through how we could communicate so much better. We try to be plain in our speaking, and we try to be human in our speaking, and we try really hard to not do the things that we are so good at in healthcare, which use all of those acronyms that we use all of the time and the niche language that healthcare people do. We try to kind of dispel all of that. So in order to do that, I think what we achieved is a recognised, trusted and liked campaign. We are liked for our purpose and our values, and we're told that on a really regular basis, which is really lovely. So I've mentioned that whole leadership thing. That the crucial thing is, if you invest in stereotypical charismatic public leadership, what you do is you invest it all in a single person often. And what we actually need is everyone to, and what that also means is that people don't feel that they're up to the job, as it were. Oh gosh, I'm not charismatic, or I'm not this person who can stand on platforms and galvanize everyone, so we're going to fail, aren't we? And actually it's the opposite. What you need to do is say we're all leaders and that we can all influence our colleagues. It's just we have to think about how we do that, and there are multiple ways we can do that. You can create a sense of urgency by being passionate about what you do. You can instill hope by providing people with some answers, some solutions, some interventions about what they could do differently. And you can motivate them by showing them the way, but you don't have to do that in a way which is telling them you must do A followed by B followed by C. It is not about micromanagement. It's about truly trusting people to do what matters to them and to work on the things that are the right things for both themselves and their patients. And if you do that, if you trust people, then they start to really enjoy what they're doing, and they recognize that you're there to help. You're there to be that guide, that mentor, that coach. And so you can, just like any coach does in, say, in sport, you can watch from the sidelines and you can cheer very, very loudly. But you can also go, oh, do you know what? If you tweaked that little thing that you do, you could be amazing. You could be even better than you currently are. And that's what we do. So we sit from the sidelines and we cheer really loudly, and we help along the way by giving people little tips and tools on how they could be even better. And we hopefully have role modelled all of that and created that respected two-way relationship. So behavioural change, it's a big issue, it's a big ask, and you can't do it overnight. So we promote the long-term approach to behavioural change. We promote the long-term approach to patient safety. We talk about this a lot. I do a number of speeches around what it's like to work in risk management, what it's like to work in patient safety. And I constantly tell people to stop doing the kind of 3-month type projects. As lovely as they are and as enhancing as they are to your skills and your development, they're not going to change the whole way in which we do patient safety. What we ask people to do is to think about it in the very long term, and I mean the very long term. Interventional research and implementation research tells us that if you're going to embed something, and what we mean by embed something is truly embed it so that it's intuitive, it's everyday practice, it's what you do without even thinking about the fact that you're going to do it. If you're truly going to embed that practice, it will take anything up to 17 or 18 years. Lots of research tells us this. Now, 17 to 18 years is a really long time, and in some respects, some people would say that's way too long. But if you have that in your head, that this might take around that time, and if you do certain things, you might even be able to reduce that to, say, down to 15 years. But if you ask yourselves, what are we going to do over the next 15 years to make a big difference? And then break that down. So we've set our aim 15 years ahead. And then you say, well, what are we going to do in 14 years, 13 years, 12 years, and so on? So how can we break that down into yearly achievements? And then how can we break that down even further so that we ask ourselves, what are we going to do in the next 3 years, and then 2 years, 1 year, and then we break that even further. Now, so this sounds really boring and laborious. It's absolutely not. It's totally motivating, because what you do is you have this dream. This is what I want to achieve in 15 years' time, but this is what I'm going to achieve in the next 3 months. And then this is what I'm going to achieve after that, and after that, and after that. And I can see that whole picture. And it's amazing because it makes you feel like you know where you really, really want to get to, and you also kind of know how you're going to do it. And and what it does is it makes you strong. when people say, do you know what, I'd quite like you to do this and do this really, really quickly, and if you haven't achieved it in 3 months, then we'll probably move on and do something else. And you will be strong and you'll say, no, we actually have a long-term plan and this is how we're going to achieve it, and we're on the first step and the second step and the third step of that journey. So those kind of things are incredibly important. I remember watching a series that the BBC did on Barack Obama, an amazing series where it looked at the way in which he's done the work that he's done across his presidency. And at one point they were talking about a successful aspect of legislation versus, so a group of people have been successful in achieving something and another group of people hadn't. And in that, it captured this whole essence. And he went up and he saw those teams and he congratulated those that were successful, and he was lovely. But he actually said to those people who weren't, you haven't been unsuccessful. You've just made your inroads into your first step. So now you need to go back and ask yourselves, what can we do the next time round for the next step? And I thought that was so positive and so engaging and so amazing, and that's what we try to do all of the time. And so we've created this central hub. We're connected to all the local hubs, and we have 390 organizations, 390 individuals who are thinking like us and thinking, what could we do in the long term, and how could we do something that's much bigger than any of us going forward. So we promote trust to do it right, trust in all of the people locally to do this, and humility. We can all do this together, and kindness. We are big on our kindness. We like to thank everyone for what they do, celebrate with everyone how they're doing it, and pat everyone on the back. So we have over 390 organisations who have joined us. As I said at the beginning, when we first started, we really didn't know whether we would. But we have a membership and spread across the whole of the NHS in England, and we have all of these people, as I've shown here, 100% of ambulance trusts, 95% of acute trusts. In England, in the NHS, hospitals are called trusts, as are larger communities of healthcare groups. And then we have ambulance, acute, community, mental health, and so on. CCGs, they are our clinical commissioning groups. They're the people that commission care in the UK. AHSNs is Academic Health Science Networks. They're the people, 15 academic health science networks who are looking at safety right across the whole of the NHS in England, and GPs, general practitioners, and care homes. We engage via Twitter, newsletters, all of the things I mentioned before, and you can see the numbers that we have. So we have a growing community of people who engage with us via all of those things, and you can see the stats, and you'll be able to see those as you download this webinar. We work very much about trying to increase the knowledge of safety in out-of-hospital care rather than in acute settings, because most of care in the NHS is provided in primary care, community care, and care homes and inpatients' homes. But the knowledge about safety at the moment in the NHS in England is in acute care. So we've got to shift that. We've got to shift that knowledge and understanding. And we make it individualised, we make it really personalised. So we talk to individual groups within acute care and individual groups outside of acute care. And you can see the sign up per organisation in that lovely map. So this is all spread out in all the different types of providers or commissioners and where they are across the NHS in England. And we also ask people to sign up as individual staff. They mainly do that locally. So these statistics are in relation to those that have chosen to do it both locally and nationally. So these are our national statistics. And we know that there are thousands of people who sit behind these statistics and who have joined up as single individuals. So you've obviously got the safety lot, there's 20% in safety, quality or governance. But we have doctors and nurses and directors and members of the public, anaesthetists and surgeons and so on. And people say some really lovely stuff about us. I've posted the nice stuff, of course I have, but this is what our members say, that we love the fact that Sign Up to Safety is about the long-term view. It's strangely liberating to start thinking about things from 3 to 5 years, let alone 15. They like the common language that we have created for them. And they like the fact that we focus on improving the safety culture of healthcare, a culture, that big word that everyone always talks about and no one quite knows how to deal with. We were also part of an incentive scheme from an organisation in the NHS in England called the NHS Litigation Authority, who gave out 18 million in funds to boost people's work in patient safety. We like the fact that we're different, and we like the fact that we share what people are doing and that we enable others to share their great work. So we celebrate all of their work. This isn't about us. This is about our members. And we build on that existing work that they're already doing, as I've said. So this is hopefully an enhancement, not an extra piece of work. So examples of our work. We've done something called Beneath the Surface, where we're trying to get to the heart of the implementation gap. So as I said before, there's a lot of research that shows us that research and guidance and all of the interventions that people feel like that they're told to do, we know that there's a big gap between that and the actual practice. And what we're trying to do is minimize that gap and bring it closer together, narrow it. And so we've held a number of events where we've sat down and talked to people and held what we describe as conversations. So this is our conversational methodology to help people get together and ask, why are we not safer? What could we do differently? And we use it in a storytelling way. So we ask people to come along with a story about whether they were involved in an incident or that they were supporting other people who were involved in an incident, or whether they were involved in an investigation or an intervention that didn't quite work. And we ask people, what did it feel like and what would they have loved to have done differently, either to prevent their thing from going wrong or to help enhance the spread of the intervention so that it started to make care safer and so on. So it could be about anything: falls, sepsis, pressure ulcers, infections, or introducing a new piece of equipment and so on. And people have absolutely loved this. We've used different methodologies, such as trios, where you have 3 people, a speaker, a listener, and an observer. We've used different methodologies using metaphor and imagery to help people explain what is going on in their everyday work. So to try to get over that whole language barrier. We've tried to dispel the whole power and hierarchy issue so that people just come with their first names and they talk to each other and they don't know anything else about each other. So they don't think, oh my goodness, I'm talking to a really important person, and they start to feel intimidated. And we think the lessons that we're learning around these conversational approaches could really help an awful lot of people in healthcare talk to each other and really truly learn how to share their stories and really truly learn how to listen. Something that an awful lot of people in healthcare are starting to realize, that listening is an absolutely fundamental skill to improve patient safety. And we know that people like John Berwick and Ara Darzi and Peter Pronovost and all the sort of lovely, amazing gurus in the NHS and in safety are saying, do you know what? What we need to do is start to really listen to each other and to our patients. So this work is a really exciting piece of work that we're doing around Beneath the Surface. So the time to speak and the time to listen and creating safe conversations. The other key thing that we do is around what we describe as rethinking patient safety. And what we don't mean is throw all of that you've learned out and start all over again. What we mean is look back over the last 15 years, as the National Patient Safety Foundation in the US has done, as people like IHI and Don Berwick has done, and the people who work in patient safety across the globe. They're all asking these key questions. What have we learned over the last 15 years? What could we embrace from that learning? And what could we do differently over the next 15 years? And they are things like not focusing on a single harm at one time, or focusing on one single incident and thinking that's going to enable us to learn. It's about trying to channel all sorts of things and pulling them together. And it is also about stimulating new ideas that are coming up from various new books that are coming out. So we've got books from Jim Reason, such as his latest book called A Life in Error, which is a short and absolutely brilliant book which summarizes his life in error, as the title says, but also summarizes everything that we know about human error in such an easy to read way. It's a joy, and is one of the recommended readings that I would suggest. So that's Jim Reason, A Life in Error. The second is Charles Vincent and Renee Amalberti. They're also short book called Safer Healthcare. And in fact, interestingly, it's a free to download book from Springer Health, the Springer publishers. And again, you can find that on Google. So it's called Safer Healthcare by Charles Vincent and Renee Amalberti. And again, another theme is that it's a short book. And so what they're realizing, all of these authors are starting to realize that we need something that's quick and easy to read, but powerful in its content. And they talk about enhancing safety not only in acute care, but they've done what I've just described before. They've shifted our thinking into primary care and beyond. And they have a whole chapter on the care of the patient at home. So if you're interested in all of those things and in the latest thinking around risk management, risk resilience, and the way in which we should look completely flexibly about safety in healthcare, from what they describe as high reliability islands, which are sort of places like radiotherapy, through to the huge unpredictable areas like our general practices or our accident and emergencies. And they look at different ways in which you can handle and tackle risk in that way. So we find all of this current thinking, we create this for all of our members, and then we share that out across webinars, newsletters, and Twitters. And we engage in the authors of all of those to really get to the bottom of why they thought what they thought, and what lessons they can share for our members. And so the sort of things that have been picked up over the last 15 years are work by people like Carl McRae, again, who have written in the Quality and Safety in Healthcare Journal, the BMJ Journal, where he talked about the problem with incident reporting. Really key reference I recommend to you. The work of Kaveh Shojania from Canada, who talked about the incident reporting as the single biggest waste of time in the last 15 years. We love these challenging statements, but what we do is we turn these challenging statements into something that's incredibly positive. So we say, okay, if we are collecting too much and we do too little, what could we do differently, and what can we help our members think about doing differently? If incident reporting has been the single biggest waste of time over the last 15 years, what could we do about that? And what could we do to help our members really think about the way they collect incidents, the way they learn from their incidents, and the way they investigate those incidents to really, truly understand why harm happens and share those lessons across organizations and across the whole system. So we've explored those experience of investigations with individuals who are worried about the fact that it's a conveyor belt, that it's a complex bureaucracy, and that patients don't feel like we're empathetic with them, and that all people want, as it says here, is a human conversation, one human being to another. And what we're trying to do is learn about how we can help people do all of that, and move away from the unidisciplinary topic by topic, which is important and vital work around looking at sepsis and VTE and falls, but to also add in the work around looking at cross-system and human factors, the whole systems thinking behind safety. So if you do the sort of first lot without the other, you're missing a trick. You're completely missing a trick. And what we do is urge you to look at those things like distractions and design and procurement and resources for safety, and really think about how you can make a difference with your communication, your observation, and tackling things like fatigue. So learning is at the heart of everything that we say and do. And finally, as Don would say, we try to instill the joy and pride across the whole of the NHS in England, because everyone needs it. So that's a kind of summary of Sign Up Safety, and I hope that you got a taster of what we do and enjoyed hearing about it. So thank you for listening, and I look forward to hearing any comments, any questions, and any thoughts that you have.
Thank you so much, Suze, for walking us through that. And as Suze mentioned, she very kindly has offered to answer any questions that you might have. So please feel free to go ahead and ask those either through the chat or question function, or also by hitting the raise hand icon. But I think I will take the opportunity to ask the first question. So many of the building blocks that you've mentioned seem universally applicable, but are there any aspects in particular that you think lend themselves well to all contexts? Or on the flip side of that, are there any that are more limited to the NHS environment?
No, you're absolutely spot on. So what I think that the principles that we're learning, which is about creating locally owned work, and this shift away from top-down telling or what feels like a lack of trust. I think that's one of the most crucial things that people say to us. And so whether you work in healthcare or even if you work in any other industry, what you need to do is to realize that the people who work in those industries are the experts. They know exactly what the situation is like in their organizations or how they do what they do. And what they need is not somebody to come around going, do you know what, I think you should be working on these 3 things. Because those 3 things are not always going to be the things that are important to them, and importantly, may not even be the things that they should be working on. And they may shift them away from what is important. And they'll begrudge that, and they won't be motivated to do those things, and they'll do them with reluctance. And what you'll do is then shift them away from what is really important and what's going on in their organization. Something that Jim Reason says, 2 things that, again, apply no matter where you work and in no matter which industry you work in, is learn about the domain that you're going to be working in and helping. So if Sign Up to Safety was Sign Up to Safety for the nuclear industry or Sign Up to Safety for aviation or wherever, the people who run Sign Up to Safety and are helping those people do their own campaigning should learn everything they can about the domain in which this is going to land. Learn about the people, learn about how it works, and learn about the cultures and the way they talk to each other. And his second key point is don't be judgmental. So if you go into organisations and you go, well, I wouldn't do it like that, or you judge people's individual actions in a critical way, you're going to turn them off completely, and you're not going to engage them, or so on. So those 3 things apply to pretty much anywhere in life. Don't be judgmental. Learn about everything about those people, and trust them. Trust them to do the right thing.
Great. And sort of getting back to the Sign Up to Safety program, I was just wondering sort of the ultimate ambition for it. Are there plans to expand to other countries, other areas, anything along those lines?
Gosh, that would be lovely, wouldn't it? So we are an NHS-funded campaign, so and we're only funded to run in England. And actually, it's really, really important to say that we're not the only game in town, as it were. We don't think that we're God's gift to safety. There's some amazing work that goes on across the globe in safety. Scotland and Wales and Northern Ireland are our closest relatives, as it were, do simply wonderful things. So Sign Up to Safety is for England, but what I would say is that the lessons we're learning, I think we've got something really lovely to share. And we're not precious about people choosing to go our way or anything, but if they want to learn from us, that's really lovely. But the way forward that we are wanting to do at the moment is there are three crucial areas that we're starting to concentrate. The first is to obviously make sure that our current membership are not forgotten and that we keep looking after them. If you get people to join, the last thing you should do is just go, right, we've done that, cool, you just get on with your own thing and we'll leave you alone. That you need to make sure that you still are part of their family and you still look after them. So number one, we'll make sure that we are ensuring the continuity of looking after our current membership. But the second thing is that, and I mentioned it in the talk, I think there's a big, massive gap. So all of our colleagues and our friends who work in safety in out of hospital areas, I think are feeling isolated and are battling away on their own to try to make a difference around safety or quality or trying to improve the care that is provided. But I think that they don't get enough attention, they don't get enough help, and people don't really see them as a priority. And I think we need to see them as a priority. So we want to do what we describe as a massive spotlight on primary care and out-of-hospital work. Again, as I say, not to forget our colleagues and our friends in hospitals, but we think that there's a crucial gap in that area. And the third thing that we want to do is work on the just culture. Now, people talk about the just culture a lot, but in our view, we don't think that people understand it as well as they could do and implement it as nearly as well as they could do. And so what we want to do is shine a light on everything that we know about the just culture, which we know came out of some brilliant work by David Marks and others in the US. But what we want to do is help. There's a new organisation called the Healthcare Safety Investigations Branch in the NHS in England, who have just been set up to transform the way in which we look at investigations in the NHS. And it's going to be headed up by somebody called Keith Conradi, who's previously from aviation. And what we want to do is help him in his role and help that branch and help everyone in the NHS to truly understand what a just culture is, because it is our belief that if you get that right, that you could actually start to transform the way people view when things go wrong. Because if you support people rather than punish them, if you actually help people understand why they have violated practices, for example, then they will truly start to figure out how you could do things differently. But also you actually gain trust and respect with members of the public and patients by the third bit of a just culture, which is you call for accountability and responsibility as well. And so those are the three things we're going to do. We're going to keep looking after our current membership. We're going to spread and reach out to our colleagues across the out-of-hospital arena, and we are going to try to really try to transform the NHS just culture.
Great, thank you so much. And I think that culture has definitely been a continuing theme across all of our webinars and all of the work that we've done on patient safety as well. And I know that we're approaching time, but since you, throughout all of the questions, have been so great about honing in on those, 2 or 3 key takeaways, just as a final question, overall, if you had 2 or 3 key takeaways that you would want to leave the audience with, what would those be?
I think my 3 takeaways are, and I hope these don't sound too touchy-feely, but number 1, really care about each other. Really care, because there's a lot that goes underneath those lines, because it's really hard to work in healthcare. As much as we absolutely love it, and every single one of us does, it's hard because it's difficult, and it's complex, and it's varied, and it's challenging every single day. And if we are not kind to each other and we don't care about each other, then it can make it simply much harder. And so I know that sounds really touchy-feely, but one key message is to really care about each other, and you can do that in so many ways, in your language and your tone and your style and the way you might just thank somebody for what they've been doing. And it just goes a massive long way. So that's care about each other. The second is that there is a dual partnership in all of this. So I've talked an awful lot about Sign Up to Safety being about helping the members and improving safety, but there's a dual partnership, and the dual partnership are our patients and their families, because the clinicians, the managers, the healthcare workers have one side of the story, and our patients have the other. And so even when it's going right, they have a brilliant way in which they can tell us, show us how that's going right, but also when it's going wrong. So we need to make sure that it is that dual partnership, and that we truly build the whole entire picture together. So that's the second key take-home point. And the third key take-home point, I'm going to go back to Jim. Learn everything you can possibly about safety, because there's an enormous wealth of expertise and experience out there. It is a science. It isn't just something that people fancy doing. But so learn everything you possibly can, and don't be judgmental.
Great. Well, thank you so much. And on that point, thank you so much for taking the time to share all of your lessons with us. And wanted to thank everyone in the audience for joining as well. We'll be making a recording of this and posting it to our website, which is www.leadinghealthsystemsnetwork.org. So I would encourage everyone to share that with colleagues that weren't able to make it today. But a final thank you to you, Suze, and hope everyone else enjoys the rest of the day.